Welcome to another season of the Aced It podcast, where we turn science into sense. In this season, we are introducing you, our listeners, to some of the Justice Community Opioid Innovation Network, or JCOIN, family. In episodes 1 and 10, you will hear from our funder, the National Institute on Drug Abuse. And in episodes 2 through 9, you will learn about cutting-edge and recent science published by some of the investigators working in the Learning to Advance Practice, or LEAP, program, a part of JCOIN. This is so exciting. So let's get started. I'm Danielle Rudes, your host, and this is Aced It. Today's episode focuses on a difficult topic: deaths while in jail custody. A study by Talid El-Sabawi and colleagues titled Dying Inside: Litigation Patterns for Deaths in Jail Custody reveals a disturbing trend. Between 2015 and 2020, hundreds of millions of dollars were paid out in settlements related to death that occurred in jails across the United States, with total plaintiffs' awards amounting to more than $292 million. This translates to a staggering human cost. Nearly 1,200 people lost their lives in jail custody in 2018 alone. These deaths are not just tragedies for communities and the families of those who have passed. They also represent a significant financial cost for local governments and jails. Large settlements can cost millions, and lawsuits may even affect a jail's ability to function and increase insurance cost. So what's behind these deaths? While it does turn out that cases attributing death to officer use of force had the highest average award, with one standing at $2.2 million, officers' use of force was not the most common reason behind in-custody deaths. The research suggests a clear link between inadequate health care and deaths in custody. Many of these jail facilities house people with substance use disorders, mental health issues, or other medical conditions. When jails fail to properly screen and/or address healthcare needs, the results can be horrific. El-Sabawi and colleagues analyzed lawsuits filed against jails following in-custody deaths. The findings show that suicide is the leading cause of death, followed by complications from illness and drug and alcohol withdrawal. Let's break this down a bit further. In the first 24 hours of custody, people are at the most risk of drug-related deaths and suicide. The El-Sabawi study's findings suggest that nearly a quarter of all deaths occur within this time frame. The first 24 hours in custody are critical. Individuals are often in severe distress, experiencing withdrawal symptoms, or having suicidal thoughts. Unfortunately, many jails lack the necessary resources and protocols to provide adequate care during this time, and this sometimes leads to preventable death. This highlights the importance of thorough screening processes and procedures upon intake, including assessments for mental health and substance use disorders. El-Sabawi and colleagues' study also emphasizes the need for improved access to quality medical and psychological treatment within jails. Many facilities struggle to provide adequate care due to overcrowding, underfunding, and understaffing. This lack of resources can have severe consequences, both human and financial. Let's bring in some additional context from another study by Seung Kim and colleagues on jail mortality, titled Deaths in the Cook County Jail, 10-Year Report, 1995 to 2004. Kim and colleagues reviewed all deaths in the Cook County Department of Corrections, Cook County Jail, for the purpose of this study. Kim and colleagues compared mortality rates between the jail population and the general population in one jail located in the county in Illinois where Chicago resides. Their work highlights the jail population's unique needs and health risks, including the fact that a disproportionately high number of individuals entering jails present multiple health issues due to their social, economic, behavioral, and economic risk factors. Their specific key findings included that the leading causes of death included heart disease and drug overdose, suggesting that preventable causes of death were prevalent. Financially, in custody, deaths are a major cost for local governments. The hundreds of millions of dollars paid out in settlements during the El-Sabawi and colleagues study period is just the tip of the iceberg. The time and money spent in litigation through lawsuits can also lead to increased insurance costs and disrupt jail operations, leaving other jail residents and the jail staff at greater risk of harm. Successful lawsuits help families and communities through financial payouts, not a replacement for the loss of life they experienced, however. But do they have the power to lead to significant changes in jail policies, including better healthcare standards and practices? So far, it seems that is not the case. As more deaths continue to occur and very little policy and practice changes seem to be lessening this dire outcome. Additionally, the cost of litigation and the payouts from these cases also strain local governments' budgets, sometimes leading to increased insurance costs, for example. I want to be sure, though, that you understand my overarching point here. It's not just about money, litigation, insurance, and policies. The true cost is human. These are human beings housed within county or state agencies like jails. While the individuals are accused or convicted of criminal activity, their humanity remains. They, and we, as community members, have the expectation that while incarcerated, they will be treated like people and afforded the opportunity to better themselves, learn from their mistakes, and perhaps most importantly, live. These deaths are preventable tragedies that leave communities and families devastated. Investing in better jail health care and improved screening procedures could save lives and reduce the financial burden on local governments. El-Sabawi and colleagues also suggest that diverting individuals with mental health or substance use disorders away from jail and into treatment programs could be a win-win solution. These two approaches are also supported by Kim and colleagues, who also suggest establishing standards for drug withdrawal treatment during intake. These approaches reduce the risk of death in custody while also getting people the help they need to address existing underlying issues. Today, we talked about the findings from a novel dataset analyzing litigation filed by the estates of individuals who died while in custody, the financial implications of these lawsuits, and the issues that lead to these deaths. This research highlights the urgent need for reform in our jail healthcare systems. Preventable deaths occur in jails, and we must think about it, albeit uncomfortable, and work to improve this so that a jail sentence does not turn into a death sentence for anyone else. Thank you for listening to the ACEIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, JCOIN, their Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters on this season, Sam Houston State University doctoral students Alexa Mata and Bryce Kushmerik-McCune. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their amazing production. Tune in again soon for another episode of ACEIT.